Dr. Natalie Azar is our NBC News medical contributor, and Dr. Shilpa Patel is a pediatrician. So we're going to start off with some questions here, a lot of questions that people have. One of the most common ones is, what can they do, Dr. Azar, to avoid coronavirus? What are you telling people about how it spreads?
So, John, what we know about this virus is that the predominant way it's spreading between people is through respiratory droplets. So that means that when an infected person coughs or sneezes or breathes heavily, the virus attaches to that respiratory droplet. It travels about 3 to 6 feet, and that's where it can infect somebody else if the other person were to then inhale that or somehow get it on them and get it in their nose or get it in their eyes. Lots of questions people have about how long it can last on surfaces and what about that mode of transmission. Experts say the predominant mode is through respiratory droplets. Yes, there are, of course, going to be cases of transmission when you've touched something that happens to harbor the virus, but it's less likely than with respiratory droplet transmission.
And we saw on the graphic there, they say that 6 feet distance is what you want to keep. Why 6 feet?
So we think at the moment, and this is a really important distinction between a virus that travels on a heavier respiratory droplet. If it doesn't hit anything at 6 feet or by 6 feet, experts think that it just drops and hits the floor. Unlike measles, let's say, which can hang out in the air and survive on dust for even 2 hours.
That's more airborne than the droplet type situation.
Exactly. And so that comes that term airborne, which is a little bit misleading because you think if it's going through the air, it must be airborne. But to be airborne, it means it needs to be able to be suspended in air for a period of time so that the infected person could walk out of the room, but their germs are still hanging around and can infect people who walk in an hour later, let's say. That doesn't happen with this virus as far as we know.
And that's why that 6 feet is such an important measurement distance. That you want to make sure you keep that distance. Now, Dr. Patel, you're a pediatrician. You do a lot with children, obviously. That's your specialty. You have some very young, very stressed patients out who are worried about coronavirus. What do you tell them? What do you especially tell their parents about this?
So we're seeing a lot of kids coming in where the parents are saying they're so nervous, they're so anxious, and it's because what they're hearing at home, what they're hearing at school, and they don't know what to do. So the American Academy of Pediatrics has a wonderful website called healthychildren.org, and I would recommend all the parents, if they could, go onto that website. And there are some talking points on there for the kids that we would recommend. And the biggest thing is in these sorts of instances, we need to let the children know what's happening, not in extreme detail, and also help them have some control over what is going on.
What kind of questions are they asking you?
So they're just saying the kids are coming in very anxious. So what I would recommend is the first thing is be very reassuring to the kids and just kind of let them know that the doctors and the researchers are doing as much as they can to help us. Second of all, let the kids be in control. Teach them, and how they can be in control is teach them how to wash their hands, how to cough or sneeze. Part of this is I see kids in the office all the time where they hold their arm up like this. Oh, I'm coughing into my elbow. And that doesn't work because the droplets go over, below, and they travel the 6 feet. So we need to teach them to either put the elbow all the way up against the mouth or into the sleeve, or my best suggestion is pull your shirt and go into your shirt, and that way it covers your nose and your mouth and is only going up against your skin, right? The other thing is let's teach them to wash really, really well, and then the last thing is to get enough sleep. So when the kids are anxious, what you'll notice is they may be extra clingy, they may be cranky, they may not be sleeping well, or they may be a little bit more distractible. If this is happening, the biggest thing I'm telling everybody is stick to your routine. You know, we're living our lives and we have to continue to live our lives. So let's stick to our routines and just provide reassurance. And then the last thing would be just to monitor the media. Watch what the kids are watching on television. If there's something that's frightening, don't let them watch that, or on social media or computers. And the older kids, as they're watching the news, go over what's going on in the news and talk about what they've heard. So if there's any misinformation or rumors, we can fix that.
So don't ignore the information because they're getting it from somewhere. You want to make sure they understand it.
Yes.
And they're getting it from you because hopefully you have a better grasp on it than they do or their friends do. And Dr. Azar, one of the biggest things we hear about, and you and I have heard about this constantly and answered a lot of questions about it, masks and gloves, in particular masks. Why is the recommendation not to wear masks out in public?
Okay, so first part of that answer, John, is the two different masks that people are talking about. One is the surgical mask, and the other one is called the N95 particulate respirator. The surgical masks are the things that people can just put on, the easier to buy. You buy them at CVS, you buy them on Amazon. Those are really only recommended for people who are symptomatic to act as a barrier. So when they're coughing or sneezing, at least there is some sort of, fortress against those droplets leaving that person. If you are trying to protect yourself from becoming infected, wearing a surgical mask will not do that. The viral particles will get through that. The N95 respirators, on the other hand, the particulate respirators, are indicated for healthcare workers. And by the way, they are not used in isolation. They're also used in combination with eye shields, gloves, and gowns. They have to be specially fitted. And we're always concerned, of course, about a looming, shortage of these. So we are really, really strongly urging people, regular folks, not to wear it.
We've all been trained in N95s.
Yeah.
Has to be sized. You take special precautions when you're using them, and you don't use them all day long. You switch them out.
You do, and actually, because of the concern about shortages, I know that my hospital has, different protocols for reusing and how to do that just in the event that there is a national shortage of them. When it comes to gloves, I think they give people a false reassurance that they are protected. If you have a glove on and you still touch your face, you still can infect yourself. All it does is just act as a barrier to your skin. So if you are going to be out and about wearing disposable gloves, you have to do just that and dispose of them very regularly.
So,
and wash your hands when you take them off.
I know a lot of people think these are giving them extra protection, not necessarily. No. And so the recommendations are not to use them, and they should probably follow those recommendations. But Dr. Patel, one of the other things we tell people all the time is, be prepared, but don't panic. What does that look like? Or perhaps more importantly, what does that not look like?
So what it doesn't look like is going to the store and buying everything and buying the store out. Please don't do that.
And I know a lot of people are buying water.
Not just water, toilet tissue, Purell, everything. Everybody is buying everything out. Please don't panic would be the biggest point to take home from this. Just a 2-week supply just in case if there is any issues, so you have enough for that. But that's it. Oh, and don't make homemade Purell. Can I please say that?
Definitely.
Thank you.
This is that DIY solution people talk about. And I've had a lot of questions about that.
Yes.
Why not make that?
So because, anything that's out on the internet, it's not something that's safe to use. There was just a case recently where there was homemade Purell and the boy burned his hands. And we don't want any issues coming out from that. And we don't want anybody getting hurt.
And they might not make it well, and they might not have that 60% of alcohol.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here. And click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.